All right, hi, I'm Morgan Pesnell. I'm going to be doing the Part 2 assessment today. This is my ID badge. I'm going to be doing my Part 2 assessment on Mac. He's also a UT nursing student. Mac, do I have consent to do this video on you?
Yep.
And then I'm going to do a 360 of the room. Alright, so now I'm going to begin my Part 2 assessment. So the first thing I would do is I would walk in the room, I would wash my hands, and then I would introduce myself to the patient saying, "Hi, I'm Morgan, I am your student nurse today." Then I would ask the patient for 2 patient identifiers such as name and birthday, and I'd explain the procedure and provide privacy to the patient. The next thing that I would do is I would ask any health history that is important to this part of the assessment. So I'd ask Mac, do you have any history of arthritis or heart attack?
Nope.
No? Okay. And then this is when I would begin my assessment. I have Mac take his shirt off. And I'm going to begin by auscultating for heart sounds. I'm going to begin in the aortic area, which is on the right side of his body in the second intercostal space. So I'm going to listen, and it's going to be in the second intercostal space on the right side. And then I'm going to move to the pulmonary, which is in the second intercostal space, but it's on the left side of his body. And then I'm going to move to Erb's point, which is in the third intercostal space on the left side. And then I'm going to move to the tricuspid, which is in the fourth intercostal space on the left side. And then I'm going to move to the mitral, which is where I'm going to look at his rate and rhythm, and that is mid-clavicular on the left side of his body. So I'm going to take it for 30 seconds to find out his pulse. Right, so with his heart sounds, I could hear S1 and S2. I did not hear S3 or S4, and there was no murmurs. And then I could hear that his rate was regular, his rhythm was regular, and his pulse was around 78. So now that the heart part is done, we're going to start by looking at his extremities. Matt, can I have you put your arms out straight for me? I can see that his arms are equal bilaterally. I can see that his color on his arms is light beige with pink undertones, and I can see that Mac only has a few lesions, which are freckles. And then I'm going to have Mac grasp both my fingers on both sides. So Mac, can you grab my fingers for me? Alright, you can let go. I can feel that his grasp is strong and it is equal bilaterally. The next thing I'm going to do is look at Mac's legs. So I am going to look at his legs, and I can see that they are even bilaterally. I can see that they are a light beige tone with pink undertones. For character, I can see that Mac does have some lesions which are in the form of freckles. I can see that his hair distribution is equal, and I can see that he has no venous patterning. The next thing I'm going to look at is at some of Mac's lesions. I can see that Mac does have a freckle on the front of his shin right here, and that would be a primary lesion. It is round, it is flat, and it is evenly distributed. Alright, the next thing I'm going to do is check for edema and moisture. So I'm going to palpate Mac's legs on both sides, all the way down to the foot. Alright, and I can feel that there is no edema. And then for moisture, you're just going to run your hand along. And I can feel that there is no moisture on Mac's legs. The next thing I'm going to check is the pulse in his feet. I'm going to start with the posterior tibial pulse. So which is going to be about right here on the foot. I can feel that the pulse is elastic, and I would grade it as a +2. And next, I'm gonna move to his duralis pedis pulse. And I can also feel that it is elastic and a +2. The next thing I'm gonna do is check for ulcerations on his legs and feet. So I'm just gonna check under his legs, make sure that there is no pressure ulcers, and all around his feet. And Matt, can I have you fan out your toes for me? So there is no ulcerations on his feet. And then the last thing I'm gonna do today is ask Mac if he has any numbness or tingling in his legs or extremities.
Nope.
And that would be the end of the Part 2 assessment. The last thing I'm gonna do before I leave the room, I would make sure the patient is comfortable and that the bed is in the lowest position, both side rails are up, and that they have their call light within reach, and then I would leave the room and document my findings.